Ministry of Health has disputed the controversial statistics on the high numbers of teenage pregnancies across the country. Health CAS Dr. Mercy Mwangangi says the numbers are not from the Ministry of Health. Zainab Mohammed now reports.
Over the past 1 week, a national debate has emerged over the controversial high number of teenage pregnancies reported across all counties. According to the statistics, the number of teenage pregnancies per county has doubled over the past 2 to 3 months, with counties such as Machakos recording numbers as high as 4,000 teenage pregnancies. Education CS George Magoha also refuted the numbers.
I want to dare say that the numbers look obnoxious and very high. As a physician, I want to tell you that pregnancies don't show before they are over 3 months. And if we are talking about the time this started, the majority of the pregnancies have not shown.
The Ministry of Health is the latest government institution to refute that those numbers are not official numbers from the ministry and that they are exaggerated and untrue.
The current data from the study that was highlighted has been found to be inaccurate, especially when we look at the extrapolation in terms of our antenatal visits by the teenage mothers.
According to the Health CAS, Dr. Mercy Mwangangi, despite there being a rise in the number of viruses during the COVID-19 pandemic, the actual number of teenage pregnancies in the country is only a third of the statistics released a week ago.
We have reviewed these numbers, as earlier mentioned, and so far, in terms of our burden, we're able to note that amongst the challenges faced is that teenage mothers do present late to the clinic.
Dr. Mercy further says teenage pregnancies is a global issue and the government is putting in place mechanisms to aid teenage mothers during this critical time.
We are putting in place mechanisms, one jointly with our development partners and with county governments, and I'm sure you've seen some of these initiatives across the different counties, to ensure that we have youth-friendly clinics available for these teenage mothers and fathers, to ensure that these services are actually friendly.
Despite government officials disputing the high numbers, what remains indisputable is the fact that there is need for a lasting solution to curb early pregnancies across the country. For TV47, I'm Zainab Mohammed.